Also, last question for you: how can our endocrinologist friend help?
I think probably NAS and fatty liver will be in future treated by our endocrine colleague only. Because
They have come up with the guideline
they
also.
are using saroglitazar for a long time. Then pioglitazone, again anti-diabetic drug. Then SEMA and these newer drugs, ALP1, everything is a drug of their choice. So in future, NASH, fatty liver, and diabetes, the treatment will be probably the same drug.
So for diabetes, we have pioglitazone, but it increases weight, so we need to be cautious. GLP-1 receptor antagonist, liraglutide and semaglutide, as Setish sir has said, these are wonderful drugs. SGLT2 inhibitor are also good in reduction of steatosis, but regarding hepatitis and fibrosis, there is the data is yet to come. And pioglitazone we have already discussed. Bariatric procedures should be considered in patients who are morbidly obese. It should be considered if the comorbid conditions permit. So our approach in this patient
will trial. So there's a consistent reduction, if I can see here, and this is about 52 weeks. 52 weeks, it's a 1 year. So 26 is 1.4. So similar, difference is maintained here, like this 0.5 or so. It's very consistent. But do you think if we continue it beyond 52 weeks, would the result change? Any one of you want to take it?
Yes.
Sir.
Yeah. I will just take it from there. And
A very pertinent question.
yes.
If you hypothetically continue it like this, would you see the same difference or something else happen?
Sure. It is.
More comorbidity, which he has recently been diagnosed with coronary artery disease. So, which obesity-related complication do you encounter most commonly in our in our clinical care? We see a lot of obese patients with diabetes. We see a lot of obese patients with NAFLD. We see a lot of obese persons with osteoarthritis. We see obese persons with other comorbidities. Also, so very commonly, we see a lot of patients with obesity with a lot of complications. But what
We
very
had to
commonly
get a wine freezer because they were so particular about how exenatide had to be stored. And believe me, 16 years ago, spending 10,000 rupees was a huge amount. Now the vial was 10,000 rupees and it produced huge amount of side effects.
কিয় আমি ভাবিছোঁ চব প্ৰত্যেক জেগাৰ এটা ষ্টাইল থাকে, আমি শিকোঁ, আপুনিৰ পৰা মই শিকিম, তেওঁৰ পৰা আমি শিকিব, আৰু যোনে স্পীকাৰ আছে তেওঁ কৰি আহিব, আহিলে তেওঁৰ নলেজ ইনক্ৰিজ হ'ব থিয়ৰীকেইটা, আৰু তেওঁ প্ৰেক্টিকেলি বুজালে অডিয়েঞ্চকেইটাও ভালদৰে কথা বুজা পাব। সেইকাৰণে চব মিলি জুলি আমি যদি কাম কৰোঁ আমাৰ পেচেণ্টকেইটাৰ কাৰণে খুবেই ভাল।